Hi, my name's Hesham, and I'm a consultant psychiatrist in early intervention and psychosis service in Peterborough in the UK. And this is the last part of a 5-part video series that I'm doing to talk about what I try and do in the psychiatry clinic. So inequalities, disadvantages, and discriminations are an integral part of working in psychiatry. One has to be aware of this and the impacts that these have on people's lives. And mental illness and disability sit at the intersection of multiple structural inequalities, disadvantages, and discriminations. And to just give a few examples: poverty, racism, misogyny, ableism. And as happens with most such structural factors, they compound the challenges and suffering of mental illness and disability, but also make it much harder for people to challenge them. And the more of one's time that one has to spend just trying to survive, the less time there is for anything else in life. So when it comes to advocacy in the clinic, to my mind, this is mainly about helping people navigate the systems that they have to and supporting them through those processes in education, in employment, in obtaining benefits that they're entitled to, in getting adequate provision for housing, accessing other help and treatment, and navigating the legal and social care systems. Now, this is what I did in the third part video, which is about the third purpose of diagnosis outside the clinic. It can greatly help people access support in all these domains. One can argue that it shouldn't be necessary, but the reality is that it does help people greatly in accessing support. So there's advocacy in the clinic and there's advocacy outside the clinic. Advocacy in the clinic is about helping people survive or manage as best as possible and fighting for them in the world that we live in with all its problems and flaws, right? As a psychiatrist, the things that I tend to do are write reports, write letters, attend panels, argue for people where I can to support them in the processes that they have to navigate. And the reality of these processes, certainly in the UK and in a lot of other countries, is that they're incredibly bureaucratic and they are incredibly biased against the people who that they're meant to help. There is advocacy outside the clinic, right? And that's an important part of what we need to do. But this video series has been about what I try and do in the clinic. And advocacy outside the clinic is about fighting for a better world. Thank you very much. If you've stuck through all the videos, thanks a lot. Comments, feedback, very welcome. And that's the end.